Lewis with Spinal Health and Nutrition. Today we're going to talk about a topic called tinnitus of the ear, also known as ringing of the ears. Okay, so what is tinnitus? It is a perception of sound in the inner ear where there is no external sound that may be caused. So the symptoms of that are ringing of the ear, buzzing of the ear, and also you're going to hear a hissing type of sound. Okay, this condition occurs in 10 to 25% of adults and some children. The causes of this are exposure to loud noises. We see a lot of people walk around with the earbuds in the ear, the headphones. So we're gonna see a lot of that coming into the office, and I definitely have to treat that. Also, once again, I treat a lot of patients who've been involved in auto accidents. I see this all the time because of the sound, the loud noise that they hear from the airbags and also the impact from the other car crashing into their vehicle. It can also be age-related. Some people have age-related hearing loss. It can also come from ear injuries, especially if someone take a direct blow to the ear. And it can be due to allergies, consumption of alcohol, caffeine, and also smoking, okay? There are other treatments for tinnitus of the ear. There's a device called tinnitus masker, which is a device that you can find on Amazon, get it from your primary care doctor. What it does is that it will help mask or reduce the sound that you may be hearing in your ear. There are also medications out there, antidepressant medications, anti-anxiety medications, because a high level of anxiety or depression can also cause that particular issue. Biofeedback therapy, the patient will be connected to this machine, which will help them relax, think positive thoughts, go through different body positions to help reduce the sound of the ear. All right. And here's where I come in play. Alternative treatment. Chiropractors also treat tinnitus or ringing of the ears. Okay. And once again, as a chiropractor, we focus on the nervous system. And one of the things that's involved when it comes to ringing of the ear is a nerve called the audiocochlear nerve or the cochlear nerve. That nerve actually penetrates on the upper part of the neck area, also known as the cervical area. Okay, so whenever there's something that's compressed that nerve there, that can lead to ringing of the ears, tight muscles due to stress, someone who gets involved in some type of whiplash injury from an auto accident, that can affect the nerve as well. And they come to me complaining, hey, ever since my accident, I've been having this buzzing, ringing, or hissing of the ears. So I pretty much have to concentrate on this area to help reduce the ringing of the ears. Okay? There's research out there. There's a research out there that states that in 2014, there was a 45-year-old woman who had the same condition. She went to go see a chiropractor, and within 8 months, she noticed that her condition actually cleared. Okay, so I'm going to show you all how we treat this condition. It's very simple. All right. So I have my patient come in who's been having this issue as well. All right. So understand you've been having like some buzzing, ringing in your ears.
Yes, sir.
Is it in both ears or just in one ear? Both.
Yeah.
Okay. And how long has this been going on?
For about 2 months.
Okay. Do you know what may have caused it?
No, sir.
No? Okay. All right. So it's been going on for 2 months now. 2 months ago, do you remember or can you recall being exposed to some type of loud noise that may have brought it on?
Yes, listening to loud music
Listen to loud music.
around loud machines.
Okay. All right. Because I looked at your history. I understand you work around machinery, right?
Yes.
Okay. So that made it possible. Okay. All right. So I'm going to do a simple test to check and see which ear is giving her more problems. Okay, she mentioned that it's involved in both ears, but I'm gonna do a simple test to see which ear is involved. Now, do you hear like a ringing sound, a buzzing sound, or a hissing sound?
I hear like a ringing sound in both ears.
In both ears, okay.
Yes.
So I'm gonna run a test here. Okay. Do you actually hear my fingers rubbing together?
Yes, sir.
Okay. Now I'm going to take a step back. Let me know if you can still hear it.
Yeah.
Okay. So she don't hear it on her left ear. So I'm going to check the other side. You should hear it. Now, which side can you hear the most? On that side, right? Okay. All right. So what I'm going to do here is I'm going to check for any misalignments on this area right here, the atlas and the axis on the upper part of the neck area. Okay. So she has a lot of motion on this side. Right. Less motion on her right side there. Okay. So I can see that this area called her atlas is stuck in the other direction. Okay. If I can head right down to that.
Will this hurt?
No, it's not gonna hurt. So I'm gonna do another very gentle technique that will help out ears. Now it's gonna be a very slow process. Some of these conditions that we treat is not going to go away overnight. It's going to take some time. It may take several weeks or a month for her to notice a difference here. How's that feel? Good?
Yes, it does.
Okay, you come on up. So she may not notice a difference right now, but what we normally do is that we have our patients on a care plan, seeing us for at least 3 or 4 times a week for another 4 weeks. Then we reevaluate, check and check the ears again. Okay. If they notice that there's some improvement with their hearing, the ringing and buzzing sound is slowing down, then we reduce the amount of visits there from maybe 3 or 4 times a week to twice a week for another 4 weeks. Check again. Once we notice that the buzzing sound has ceased, at least once a week or every other week, to monitor to make sure that the sound doesn't come back. Okay. If you're having this issue, there are some other alternatives out there. If you don't want to have anything invasive done, okay, definitely see a primary care doctor about this. If the condition is worse, definitely follow their treatment plan. They have you using the devices like the Tinnitus masker or any other device. Continue to use that. But if you want to try the alternative way to solve the issue, definitely see a chiropractor. We can definitely help out. All right. Once again, I'm Dr. Lewis. Please subscribe, share to our YouTube channel, and remember, your health is your greatest investment.